Hi everyone, Dr. Lindy here. In a previous video, we spoke about muscles of the upper extremity, but we focused on muscles around the scapula, muscles that attach to the proximal humerus, those rotator cuff muscles. We spoke about the main muscles of the anterior arm and main muscles of the posterior arm. We showed you the two heads of the biceps, three heads of the triceps. Now we're moving down to the forearm. And this is the lateral view. This is the right hand. I can see the thumb right here. This is the web between the thumb and the first digit right here. So this is taking the arm and just looking at it a little bit more from the lateral view. And there's a really important muscle that I mentioned when I talked about the biceps brachii. We spoke about the biceps brachii, and then we spoke about the brachialis, and now we have the brachioradialis. Now the brachioradialis, this is one of the only muscles in the body that originates, we'll put an O here, for originates at the distal end, of one bone, and it goes all the way here to the distal end of another bone. There are very few muscles in the body that do that, if any, but this one goes all the way down and attaches right there. So the origin is at that lateral epicondyle, of the humerus, and the insertion is on the radial styloid. This is why knowing those bony landmarks are so important. And I knew that the ones that I would ask would be linked to the muscles. So the brachioradialis is an elbow flexor, but from the neutral position, not supinated, not pronated, in the neutral handshaking position, which is why we call it the politician muscle. Because a lot of politicians get very, very sore from shaking all those hands at that lateral epicondyle because of the origin of the brachioradialis. Again, it's the only muscle in the body that originates at the distal end of one bone, which is the distal end of the humerus, and it goes to the distal end of another one, which is the distal end of the radius at the radial styloid. Now we're taking the forearm and we're looking purely at the superficial view of the anterior forearm. And there are four muscles that are really important. 1, 2, 3, and 4. And from lateral to medial, this muscle here is called the Pronator Teres. It pronates the forearm. Number 2 is the Flexor Carpi Radialis. Now, one of the things I want you to look at is that muscles 2, 3, and 4, not number 1, but muscles 2, 3, and 4, they're all anterior forearm muscles, but look what they cross. They cross the wrist. Now, if they cross the joint, it has to act on the joint. So even though it's considered to be a forearm muscle, if you follow the tendons, they cross over the wrist. And if they cross over the wrist, it's going to have to move the wrist. And since it's anterior, these muscles are going to be able to flex the wrist. So flexor, because it's anterior, carpi, because it crosses the carpals, and radialis, because it's on the thumb side, which is where the radial bone is. So we call it the flexor carpi radialis. Now, if there's a flexor carpi radialis, let's look at number 4. It's anterior, so it's a flexor. It too crosses the carpal, so it's a flexor carpi. And since it's on the medial side where the pinky is, that's the ulnar side, we call it flexor carpi ulnaris. So there's a flexor carpi radialis on the radial side, And then there's a flexor carpi ulnaris on the ulnar side. And between number 2 and number 4 is number 3. And if you look at number 3 and we follow that tendon, it's right here. It's superficial. It's superficial to this gray structure that runs across this way. That's called the, I know the spelling will come up in the next slide, the Flexor Retinoculum, or it's called the Volar Ligament, or it's called the Transverse Carpal Ligament, because it runs transversely along the carpal. So it's called the Transverse Carpal Ligament, it's called the Volar Ligament, or it's called the Flexor Retinoculum. And this Flexor Retinoculum's job is to hold down all of these flexor tendons that are deep, except for this one, which is superficial. Number 3, which is the palmaris longus, because it's superficial to the palm. It's above the Flexor Retinoculum. Okay, so we have 4 muscles, and they all originate right here. Their origin is on the medial epicondyle. The medial epicondyle. So right here, see if I can show this on the camera here, you'll see that I'm flexing my wrist, and right here on the medial side, when I flex my wrist, you see that I'm pumping even some of my fingers and wrist, I'm pumping these muscles along the medial epicondyle. Those are wrist flexors. That's along the medial epicondyle. Antagonistically, if I go to the other side, which is the lateral epicondyle, and I extend my wrist, same thing, you see the pumping action of my fingers, I'm contracting the extensors. So the wrist flexors are along the medial side, the medial epicondyle, and then the wrist extensors are along the lateral epicondyle. They're opposites. Okay, so especially number 2, 3, and 4, since they cross the wrist, they're going to act on the wrist. Pronator teres does not cross the wrist. Its job is to pronate the forearm. Okay, it doesn't come anywhere near the wrist. So now what we're going to be doing is we're taking numbers 1, 2, and 3, and 4. We're going to cut this away. We're going to remove this so we can see what's deep to it. We're going to look at the layer deep. So once we pull that away, we can still see the tendons, right? Here's the Flexor Carpi Radialis, but it's cut. So this is the Flexor Radialis tendon. Here, right down the center, superficial to the Flexor Retinoculum, right? That's the palmaris longus that's cut. And this large muscle that's very deep to it, it's deep to these two. It's the largest muscle of the forearms anterior. It's called the Flexor Digitorum Superficialis because it's superficial for the muscles that flex the digits. So it's a forearm muscle. The belly is here. It's going to cross the wrist. It's going to go to the fingers. It's going to go to digits 2 to 4. It doesn't go to the thumb. So the Flexor Digitorum Superficialis is going to go to digits 2, 3, 4, and 5. Okay. Now, excuse me. Thank you.
Bless you, Professor.
Thank you, thank you. So now, if there is a Flexor Digitorum Superficialis it leads us to believe there's probably another flexor digitorum that's deep to it. Because of this word, which is a descriptor, it leads us to believe there's got to be another one that's deep to it. So if there's a flexor digitorum superficialis that's going to flex digits 2, 3, and 4, and 5, 2, 3, 4, and 5, digits 2 to 5, I may have said 2 to 4, but it's 2 to 5. There's got to be another one deep to it. And there is. So let's dissect this away. Let's remove this. And now we have the deeper one called a flexor digitorum profundus. Flexor digitorum profundus. So now what I want you to see, let's look at the tendons right here. Let's look at this tendon, this tendon, this tendon, and this tendon. So those blue lines that I drew, those are the tendons. Those are the tendons of this, the flexor digitorum superficialis. So here, and here, and here, and here, those are the superficial tendons of the flexor digitorum superficialis. But one of the things that I want you to see is right here, you see it splits. You can see here, it splits. Okay, and you can see here, they split. See how the tendon splits into two? And there's a reason for that. Even this one, you can see that it splits. It splits so that the flexor digitorum profundus, let me change the color here. We'll make that one red. So the flexor digitorum profundus pierces, and you can see it here, right between that slit. Where the split is, that's where the flexor digitorum profundus pokes its head through and goes all the way to the end of the fingertips. So the flexor digitorum profundus inserts all the way at the fingertip, all the way on the distal phalanges of digits 2 to 5. 2 to 5, they're distal phalanges. So it can do this action. It can flex the dip joint, the distal interphalange joint. But this one, the flexor digitorum superficialis, it inserts on the middle phalanx, right? That's the one that goes down and splits and attaches to both sides of the middle phalange, which means it can only flex every joint proximal to it, but it cannot flex the distal phalange because it doesn't insert there. But since it crosses the wrist, it can flex the wrist. Since it crosses the metacarpal phalange joint, it can flex here. And it can also flex at the proximal phalange. That's for the flexor digitorum superficialis. The distal one that goes all the way down to the end, the flexor digitorum profundus, can do the exact same thing. It can flex the wrist. It can flex the metacarpal phalange. It can flex the proximal interphalange, and it can also flex the distal interphalange because the flexor digitorum profundus inserts all the way at the end, which means it's got to be able to flex every joint proximal to it. Okay. Okay, what else do we need to look at here? Let's skip here and let's go to the posterior forearm. We know we're looking at it from the posterior because we see the back of the hand. Right over here, we're looking at the anterior hand. Here, we're looking at the posterior. Now, I'm going to try and divide this to make it a little bit easier. We're going to have 3 muscles here. Let me change the color. Let's make it blue. It'll be easier to see. Let's make it blue. So here around that lateral epicondyle are 3 muscles. We call it the mobile wad of three. Like if you were to pinch your forearm on the lateral side, you're pinching these three muscles here. One of them, number one, is the brachioradialis. Then we have ECRL and ECRB. ECRL and ECRB. So these are on the posterior side. So on the posterior forearm, we have muscles that are going to cross the wrist as well. Since they're on the posterior, they are extensors. They do cross the wrist, so they're extensor carpi. And they're on the thumb side, which is the radial side, so they are extensor carpi radialis for both of these. The only difference is that one we call brevis and the other we call longus. What does the longus and the brevis relate to? The longus and brevis don't relate to the muscle. It actually relates to the tendons. So the extensor carpi radialis longus, you could see the tendon starts right here. It's going to have a much longer tendon. The brevis starts here. It's a shorter tendon. So there's an extensor carpi radialis brevis and an extensor carpi radialis longus. How do you know which is which? Well, they're on the posterior side, so they're extensors. They're on the radial side, so it's extensor carpi radialis. Look for the tendon that's longer. It's going to get the longus, and the shorter tendon is going to get the brevis. That's how you name them. Okay, now we're still on the posterior side, so they all are going to have extensors in their name if they're on the posterior side. And this one looks like number 17. So let me erase this and clean it up a little bit. Right here, number 17, if we look at the tendons, it goes here to nut digit 2, digit 3, and digit 4. That's called the extensor digitorum. Nice and easy. Extensor digitorum. It doesn't go to the 5th digit because the 5th digit has its own. It's got its own unique name called the extensor digiti minimi, or some say digiti minimi, right? Extensor digiti minimi. So the pinky is always called digiti minimi. The thumb is always called pollicis. So the one that goes just to the pinky and it's on the posterior side, extensor digiti minimi. Okay, the one that's the most medial, right, because it's closer to the pinky, this one here that's on the ulnar side, right there, coming around, that is an extensor carpi, and since it's on the ulnar side, extensor carpi ulnaris. And again, the extensors on the thumb side are extensor carpi radialis. You have two of them, but remember, one has the longer tendon, which we see here, and then the other has the shorter tendon. So that's how you know which is brevis and which is longus. And then there's your brachioradialis, which is your elbow flexor from the neutral position. This is number 1, this is number 2, this is number 3. They call it the mobile wad of 3 because when you grab your lateral forearm, that's what you're grabbing, 1, 2, and 3. Okay. All of these are going to originate on the lateral epicondyle of the humerus, or at least very close to it. Whenever there's overuse of these extensors, people can get a condition called tennis elbow. Tennis elbow. Sometimes they call tennis elbow, they call it lateral epicondylitis, right? Anytime you have itis at the end of a word, we know it means inflammation. So tennis elbow is also known as lateral epicondylitis, where there's such pain and sensitivity near the lateral epicondyle due to chronic overuse of the wrist extensors. They typically call it tennis elbow because from a improper backhand in tennis, there's that overuse of the wrist extensors. It's called tennis elbow. When people play golf and their wrists are flexed, they can get the overuse of these wrist flexors, and then they call it golfer's elbow. Golfer's elbow, or they call it medial epicondylitis, because there's extreme pain and sensitivity over that medial epicondyle, and it feels like deep, deep bone pain, but it's not the bone that hurts, it's the overuse and contraction of all of the muscles that attach to that part of the bone. So golfer's elbow is pain along the medial epicondyle from the chronic wrist flexion and finger flexion that takes place from holding the club, whereas tennis elbow is from the constant wrist extension and overuse of all of the wrist extensors. So there's deep chronic pain over the lateral epicondyle. Okay, that's the difference between tennis elbow and golfer's elbow. Okay, looks like we're finishing up here. And right here at the thumb, we have three important thumb muscles. That's called the Abductor Pollicis longus, which is right here. This is your thumbs up muscle, right? A thumb up. This is what brings your thumb away from the radius. That's abduction of the thumb. So it's your Abductor Pollicis longus. And then we have, so let's call this number 1. Let's call this number 2. And then we'll call this number 3. Then we have two extensors of the thumb. They're called extensor pollicis. And again, we see longus and brevis. What is it that determines whether it gets the word longus and brevis? Just like I mentioned before, it's the length of the tendon. So if we look at this one has a much longer tendon compared to this one. Okay, but they both extend the thumb. One's an extensor pollicis brevis, another is an extensor pollicis longus. These three muscles, when you do a thumbs up, it gives you that depression right here at the carpal bones. You can actually poke your finger right in that depression. If your thumb is up, there's a little fossa, a little depression right there. And that little depression is called the anatomical snuff box, because people would put cocaine in there and snuff it. That's where how they would snort cocaine. They'd actually put it in the anatomical snuff box, and they would snort cocaine right from the anatomical snuff box. Little history to these three muscles. Okay, and when we take away this muscle, this is the Brachioradialis that would have been going from here. It's cut and attached here. Here is your Pronator Teres. And what opposes a pronation, what opposes that is supination. So deep to the Brachioradialis, this way is the Pronator Teres, and going this way is the supinator. It's not called supinator teres, it's just called supinator. So once you find the pronator, which is at the medial epicondyle, over here on the lateral side, this is the lateral epicondyle, we'll find the supinator. And they oppose one another. They are antagonistic. The Pronator Teres pronates the forearm, the supinator supinates the forearm. Just remember, supination is holding soup. Pronation is when you're prone to spilling it. Before I mentioned the Flexor Retinoculum, I also called it the Volar Ligament, and I also called it the Transverse Carpal Ligament. So it runs this way, and here's a close-up view, number 37. We could see that it runs transversely. Here, this one is the tendon that's superficial to it. So that one is called the palmaris longus. And this one is your Flexor Carpi Radialis. That's your Flexor Carpi Radialis. And then this one here is your Flexor Carpi ulnaris, because it's on the ulnar side, which is the pinky side. And then here's the close-up view. Here, 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 and here, right? This is the flexor. Let me label this one. These are the tendons of the Flexor Digitorum Superficialis, and we can see that it splits. All of them split like a yield. And when they split, you can see the deeper tendons here, here, and here. Those are going to be the Flexor Digitorum Profundus. Flexor Digitorum Profundus. Now, the reason why the Flexor Retinoculum is important is all of these flexor tendons, the finger flexors, the FDS and the FDP, they're deep to the Flexor Retinoculum. And besides those finger flexors that are deep, you see number 73, this nerve? Look at that. This nerve goes to the thumb. It goes to the second digit. It goes to the third digit. And it goes to the fourth digit. That nerve is called the median nerve. And what happens is if you use your fingers a lot and wrists a lot, let's say you're typing all day, or you're a massage therapist working with the fingers, or you're a barber or a hairstylist using your fingers all day, all of those finger flexors, those muscles and tendons thicken because they're being exercised and they're being used all day long. So they thicken up. And when they thicken up, the space underneath the Flexor Retinoculum, we call it the carpal tunnel. So the carpal tunnel is deep here. It's a tunnel for which the median nerve travels, and the Flexor Digitorum Profundus and Flexor Digitorum Superficialis, they all travel deep. So if those tendons thicken up, the room and the space for the median nerve gets less, and you get a nerve impingement. You start to get shooting pain to the first, second, third, and half of the ring finger. That's what we call carpal tunnel syndrome. So many people get surgery where if there's a carpal tunnel syndrome due to thickening of all those tendons, they cut the Flexor Retinoculum, they loosen this up to give it a little bit more breathing space and breathing room for all of those tendons that run deep to it. And if there's a Flexor Retinoculum on the opposite side, same concept, there's an Extensor Retinoculum. And all they do is hold down, like a wristband, they hold down all of those extensors. They hold down this, 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 those three. That's the Extensor Digitorum. And then this one, the Extensor Digiti Minimi. And then this one, the Extensor Carpi Ulnaris. They hold all of those down. That's the purpose of the Extensor Retinoculum.